Now, a major enforcement operation is underway in the Ashanti region as the Health Facilities Regulatory Agency, HeFRA, launches a large-scale crackdown on unlicensed and non-compliant health facilities. The exercise, which began earlier this morning, is targeting over 200 clinics, laboratories, maternity homes, and other healthcare centers operating without the necessary authorization from the regulatory body. According to HeFRA officials, the operation is part of a nationwide effort to ensure that all health facilities meet the required operational and safety standards. We'll take you live to Kumasi shortly, but first, listen to HeFRA's Public Relations Officer, Christabel Ayiram. Well, let's go on phone and via Zoom actually and engage my colleague Nana Boachi Yadom before we see if we can bring you that. But Nana, tell me, how has the exercise been so far, or the operation, I should say? Has it started? And since it started, how has it been so far?
The operation has been a success today in the Ashanti region. We're expecting over 200 health facilities to be closed down or shut down in the Ashanti region, as indicated by the HeFRA PRO. It's going to be a week-long activity which started this morning. So far, we've had 3 facilities closed down by HeFRA authorities and the task force led by the police. One eye clinic around the Fort Garrison area, Edum, has been shut down. And now we are inside Guinness, Ghana. We are told that a facility is operating inside Guinness, Ghana, and it is going to be checked. Their licenses are going to be checked. If they do not have the license, HeFRA would then have to move and then shut it down. There was a little bit of confrontation and delay made by the authorities because they were not allowing the HeFRA task force to enter. But then as I speak to you, they've made their way in by force and they are going to check the facility. But I still have the HeFRA PRO here with me, Christabel Ayiram, to interact with me shortly. Chris, the operation started smoothly from the 3 places and here seems tough.
Yes, it seems tough, but then we are up to the task. We are up to the task because we are very determined. Any facility operating in Ghana must be licensed by HeFRA once you are rendering health services. So you saw what happened over there, but because we are determined, we still broke our way, we entered and we are going there. It is either you show us your license or we are closing down the facility. We understand that because this is a big company, there are some protocols that we may have to follow, but we also wanted them to understand that this is a regulatory body. So, and we can barge in at any time because we do announced inspections. Some of the monitorings that we do are unannounced. We don't have to inform you that we are coming. So once we come and we have shown you our ID cards, we have come with the police, you have seen that we are officials from the health, from HeFRA, I think that you would have to let us in. So to actually prevent us from entering, I think it wasn't right on their part. Thank God we are in now. So we are now going to the facility. So the Health Facilities Regulatory Agency, we are determined. No matter how big you are, you just have to do the right thing. So when we go in there, it's your license or we are closing you down.
And we are expecting over 200 health facilities, just as you indicated to me earlier, to be shut down in the Ashanti region alone. This raises concern about public health.
Well, in the Ashanti region, we have, you see, we would be lucky, for the data that we have over 200 facilities operating without licenses. So it's not going to be a one-day exercise because, like I explained earlier, because of the public advocacy and the public announcement that we are doing, some are coming. As we speak, I think some people have trooped to our offices and then they are doing the right thing, they are paying for inspection, and then there is a team on standby going to inspect their facilities. So it could be that by the time we are done with this exercise, maybe this week, the numbers may reduce because a number of them would go, and because they've heard what we are doing, they would go and then kick in the process. And for us, my boss has actually set up a special team. So once you go there and then you register, you bring all your requirements, we are ready to inspect your facility immediately. And once we inspect the facility and we know that the facility is actually doing the right thing and has met the standards, why not? You'll be giving your license. We don't take pleasure in locking down facilities, not at all. But then the right thing has to be done.
The concern being raised by some people is that most of the times there are patients in some of these facilities, like the one we visited at Konfanoche. What happens to these patients who are coming to seek health care?
Okay, so when we go into a facility and then there are patients that need to be referred, immediately we bring in the ambulance. So we have made all those arrangements are in place. We bring in the ambulance to transfer the patients to a different facility that is licensed, where maybe the people don't have to be referred. It's not very critical. Then just like we did at the other facility, we inform them that whatever we are doing is in their interest, for which reason they would have to vacate for us to lock the facility.
Thank you very much. And that is Christabel Ariam. She is the Public Relations Officer for HeFRA. But the facility itself that is being locked at the premises of Guinness Ghana is right behind me, and that is where we are walking towards. The police task force and then the HeFRA task force are all moving to that direction. We're being told that, as of now, they've confirmed that the facility hasn't registered with HeFRA. The authorities at the Guinness Ghana Kumasi branch insisted earlier on that they had to speak to their legal team before they would allow the HeFRA task force to enter. But then the regulatory body resisted that and barged in and came in with force to inspect the facility. And so this is the facility you see there with the HeFRA task force and then the police, all of them gathered over here. We also have possibly the authorities of Guinness also in here. This is the ward. This is a facility that takes care of patients who come in to seek health care. We've been told that it's both for public and then for staff who operate here, and HeFRA would be doing a massive crackdown of this facility. So far, 3 facilities have been shut. This adds up to be facility number 4. The regulatory agency says that it is bent on shutting down all these facilities if they do not have licenses or if they are not regulated or registered with HeFRA. And so this is and the indication that we have is that you say since 2019?
Since 2019. Yes.
Since 2019.
For the past 6 years.
So for 6 years now, we're being told that this facility here at Guinness Ghana has not been having their license. They've not renewed their license, and that is the confirmation that we have right now. And this is the facility that we have here inside Guinness Ghana. And so this is what is happening in the Ashanti region. MFA, HeFRA have moved into the premises of Guinness Ghana, and now we are going to have the facility locked. We have to move out for the facility to be locked. So you see the padlock belonging to HeFRA that would be used to lock the facility, so they would not be able to operate. So that is the operation that is happening, locking the health facility at the premises of Guinness Ghana in the Ashanti region for not renewing their licenses since 2019. 6 years now. So this is part of the operation by HeFRA in the Ashanti region. MFA.
Thank you so much for bringing us that update. So 200 health facilities, you say, 3 already shut down, 1 still in the process. We have about 196 more to go. You want to stay with us? Nana Watch will bring us all of that details from the Ashanti region. But